Psychiatric disorders. Now, when we talk about psychiatric disorders, clinically, and now we are not going to talk about any theoretical aspect, but the practical aspects about it, so that we can understand what exactly we are supposed to do in case of the practical management about psychiatric disorders, and also we can understand about the seriousness about the problem. Now, first of all, why exactly psychiatric disorders are important? What we are going through for so many days and so many weeks of the free lecture series, that general practitioner has to know about the psychiatric illnesses. Now, the reason behind that, because the trend is increasing. Not only initially it was a thought process that only those who are uh, completely not normal require the psychiatric opinion, require the psychiatric visit. What we see these days is even a normal looking person has got lot of psychiatric disorders. We can see in the community also there are a lot of people who are not behaving properly. Not only for a normal behavior, but we also require a psychiatric help for succeeding in life. And because of that, we thought these type of illnesses are going to be very, very important. And if a general practitioner is well trained into it, there are certain advantages, and that is what brings me to take these lectures free of uh, cost for all the general practitioners as well. Because if there is a family who has got certain psychiatric problem in a family member, they will definitely be reluctant to go to a psychiatrist, because they think that a psychiatrist help will be required only if the person is going to be proper psychologically imbalanced. And also they are afraid to go to a psychiatrist because the society comes to know about it, then the society may look at the person in a different perspective. And because of that, if some sort of psychiatric illness, and I can see 90% of the psychiatric illnesses can be managed not by the drugs but by a plain counseling. And because of that also I can think that these common disorders need to be known by everyone, so that we can understand them, we can understand the seriousness of them, we can understand the value of counseling in case of psychiatric illnesses. Yes, drugs will be required. I'm not denying that certain illnesses may going to would be requiring uh, psychotherapeutic agents, because ultimately these are going to be working on the neurotransmitters which are responsible for psychiatric illnesses. We'll be going through it step by step. But initially I can say 5 minutes we have been spending on something about seriousness about the issue. We also have understood about the role of counseling in it, so that we can, because all these drugs, when you talk about the side effects, they are huge. Long term side effects, they may suppress the normal skillful behaviors also. They may increase the appetite, they may increase the sleep, they may increase the obesity, they may give rise to hypertension, diabetes, etc. So these drugs, I'm not saying these are very safe drugs. When they are required in case of serious psychotherapeutic illnesses, psychological illnesses, we are going to be requiring those psychotherapeutic agents. But 90%, like you must have been aware about, like for example, anxieties, depressions, phobias, obsessive compulsive disorders, even certain personality disorders also, even the eating disorders, bulimia nervosa, anorexia nervosa, phobias, all those things can be easily managed by a psychological counseling. And being a general practitioner, being an MBBS graduate, or being even the Ayush graduate also, you can very well do the counselings. And every common patient may not afford to go to a psychiatrist. So if you are able to understand these problems well, if you are able to understand the value about these problems, if you can treat those not by the drugs but by the counselings, you are going to be huge in the community as a doctor also, and you're going to be helping the patient. Now remember, when you treat a patient of, let's say, fever, and the patient is cured, patient is going to be remembering it for, let's say, few months. But if you treat a patient of psychiatric illness, believe me, his whole life is going to be changed because of you. And that is the reason also we think that these disorders need to be taken very seriously. Most of the psychiatric illnesses, if you can see, are arising during the adolescent life, or I can say most productive life years, young age, let's say, for example. So if you treat these disorders, maybe he is the only earning member of the family. So what have you done? You have not treated one patient, you have treated the whole family. You have upgraded the whole family, and that is also one of the very important reasons. We need to take these illnesses very seriously. We need to take of course, these lectures are not going to make you psychiatrist, not going to make you psychiatrist, but these lectures are going to make you aware about the problem, aware about the situation in the common community, and also is going to make you understand the treatment part of it. When exactly is going to be patient is going to be requiring the specialist help, you can very well refer the patient to a proper MD psychiatrist. But at least 90% of them can be easily managed at your level with the help of good counseling, with the help of because being a family physician, if you are a general practitioner, patient is going to be trusting you more. So counseling is going to be more helpful. We listen to those whom we are known to, rather than when we are taking advice from someone who doesn't know us or whom we don't know. So general practitioner has got a very important role in psychiatric illnesses. So I thought I can just spend maybe 5 to 10 minutes on why exactly these disorders are going to be important, why everyone is supposed to know these kind of disorders, and these disorders require to be treated at the early stages. Because when these disorders are going to be taking the chronic illnesses, then not only the psychological problems, but also this goes into a physical problem. Because many times, because of the illness, patient may also go into certain organic disorders, like for example heart problems and hypertension and diabetes and certain other. Maybe patient is also going to be end his life in case of a depression. So if you are able to identify these problems more, it's going to be very important. One word about, there is something called as adolescent psychology. Now this is going to be very, very important. Why exactly adolescent psychology is important? Because this is the stage of life when the boy or a girl is going to be transforming into an adulthood. And this period, especially in today's digital age, this boy or girl who has got some psychological problem, maybe these years are going to be reflecting, augmenting the entire life of this particular person, or I can say boy or girl. So if you are able to identify these problems, a lot of these adolescent children has got their own psychological taboos, their own psychological understandings. They may go through here and there some Google knowledge, and they can also make a thought process which is going to be developed and influenced by these, and that can create a lot of problems. So you as a general practitioner, maybe an MBBS graduate and IS graduate, you can find out these problems. Maybe family is more comfortable to discuss these problems with you. Because of that, I thought I can go through these lectures so that we can relate to it. So before we enter into any of the details about psychiatric illnesses, I thought I can share with the seriousness about it and why exactly we may require these lectures.